All right, we are on.
We
So,
are.
oh my gosh, I can't believe we finally made this happen. Our crazy lives and our busy schedules was like, we have to do something for Endo Awareness Month. Um,
Yes, true. But it's good that we could do it even in the midst of this cyclone hitting.
oh my gosh, I thought it was going to hit us up here because it was heading this way and then it just went south and I was like, oh my goodness. But
Yeah,
there's such a bigger population down there. So I'm like, oh, I hope it's not too bad. I'm just thinking about like the beachfront properties on the coast. I'm like,
I know. We will see.
yeah, my mom was supposed to fly out of Brisbane Airport on Friday and I was like, there is absolutely no way. Like change your flight. We were on the phone.
Oh, yeah, there's no way that would have happened.
Yeah. So we were on hold for like an hour yesterday because apparently everyone was doing the same thing, changing their flights.
Yes, I don't, yeah. If you can get out, I mean, a lot of people leaving today. I've got a few friends up here from Melbourne and they're
Yeah.
trying to get out today. Otherwise, they're potentially going to be stuck here, like you said, until next week.
Yeah, exactly. Yeah.
We will-
So
we will-
I'm glad we changed that.
Yeah.
So let's talk endo. Where should we start? How are you feeling today?
I mean, I feel great today. I feel really, really good today. How do you feel?
I'm okay. I had this weird like ovulation discomfort that I've been having the last couple cycles, and I think it's related to I've recently been diagnosed, FYI, I've been recently been diagnosed with like pretty severe pelvic venous insufficiency. So it's not endo at all. It's actually the veins and the blood and the lack of flow and the refluxing blood through the pelvic and gonadal veins all through there. So I think that that's what it's all linked to. But I'm okay. I have nothing to complain about right now.
I think you should share, if you feel comfortable, sharing a bit more about that because it's quite common, well, not common, but with endometriosis patients as well, right? We see you've been seeing some of these issues with more venous
Um,
concerns.
I think that it is something that is so incredibly underdiagnosed in
Mm,
women with endo.
mm.
So just to give everybody a heads up, I have been journeying with endo for about 24 years, and I've had one excision surgery about almost 13 years ago now. And yeah, luckily just the one surgery. Very grateful for that. But I have been dealing with a condition called POTS. Now, I don't know if you guys are very familiar with POTS or not, but it is a form of dysautonomia. So it is a dysfunction of your autonomic nervous system. But POTS is a symptom. So it's really about finding the root causes of what's causing that POTS. So the POTS is where with postural change, like from sitting, standing, bending over, standing up, you have dysregulation of your blood pressure and heart rate. So your heart rate will skyrocket. It's not necessary that your blood pressure drops, but that causes a whole range of symptoms because blood isn't flowing properly. A lot of people with POTS have endo. A lot of people with POTS have mast cell activation syndrome. A lot of people with POTS have hypermobility or EDS. So there's a connective tissue component there. But with regards to the pelvic venous insufficiency, we've got veins that, if you look at the anatomy, we've got veins that go from around your kidneys, from your renal veins that go down into your ovaries, basically. And for whatever reason, these veins can be enlarged. The function of your vein is essentially to push blood back up to your heart. And so they have these little valves to prevent the blood from refluxing, so backflow. And in pelvic venous insufficiency or pelvic venous disorders, these veins essentially become dysfunctional. They blow or they no longer, prevent backflow. And so you've got this refluxing, blood going the wrong direction, lots of blood pooling, and then that can cause a lot of the similar symptoms that we see in endo, like heaviness, pain with intercourse, referred pain down to the butt and down your legs. Just think like a lot of blood that's just kind of sitting there and not really moving around. So, um, yeah, my veins are pretty bad, and I'm looking into doing a bilateral ovarian vein embolization, where literally they have to kill the veins, like shut them off completely because there's just too much blood accumulating there. It's not moving in the right direction. It's causing blood pooling. It's causing symptoms. So I always wear compression tights like up to my ribs to kind of help. But we are definitely needing to do something more than this. So I'm seeing a surgeon next month. And yeah, it's very strange because there isn't a real like cause to it. So sometimes if you have compression in the renal vein, which is the vein higher up from there, it can cause flow issues lower down, and these veins can enlarge. But I don't have any of that. So we're thinking it's probably like primary varicose veins from pregnancies, which is really interesting. And we know that you can get, hemorrhoids in pregnancy. So this is what this is all about. And if I have the connective tissue stuff, which I know I have the hypermobile joints, I've got that predisposition. So all the fun stuff.
Just the gift that keeps on giving, pregnancy, isn't it?
Wild. I had such rough pregnancies too. I'm just like, oh my gosh.
So,
Oh,
how are you feeling about meeting with a surgeon and potentially doing this surgery?
I'm so excited. Like, very excited because I have vascular compressions. I have thoracic outlet syndrome. So I've got compression in here and it prevents optimal blood flow into my head. And of course, lymphatic congestion too. And we know how important it is to have lymph moving through the pelvis, through all of this as well, to drain the importance of lymph flow. I can't, overemphasize because that's, when we're dealing with inflammatory conditions like endo, it takes away all that debris and immune products. So, yeah, we shall see what he says. One thing at a time, though, and it's probably going to be the ovarian veins first.
Absolutely. Now, can you share with everyone too about your MRI? Because that was all happening at the same
Oh,
time.
yes, 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 yes. So. Okay, so I wanted to rule out whether this ovarian pain was endo because I had endo on my ovaries and I thought, oh my gosh, maybe my endo is back and it's causing this pain on my ovaries. I'd wake up in the night and feel like stabbing pains, referring to my rectum. And I was like, well, this is like classic, lightning bolt pain. And but it would come and go really quick. And it was often relieved by like going to the toilet. If I need to do a poo, it would make it feel better. So I was a little bit like, oh, I was unsure. So I drove like 10 hours to get to the best of the best imaging. Um, and I'm FYI doing a Instagram live with the head radiologist and owner of this clinic because he specializes in very unique MRI techniques and sequences to detect endo. So I did this MRI, I did a CT scan, I did an intra-abdominal Doppler ultrasound. So it's different to normal ultrasound. They measure the velocity of the blood that's flowing through your veins, and it's done by specialist vascular sonographers. So they know exactly what they're looking for. So I was like, I need to rule out if this is endo or if this is vascular. So did the intra-abdominal ultrasound, did the CT scan from my head down to my pubic bone, basically head to trunk, and then did like a trunk MRI. CT was done with dye, MRI was done with dye. Bad reaction to the CT dye, never doing that again. MRI was fine. And there was no evidence of endo, no evidence of adeno, no fibroids, which like was a massive, massive win. I was like, oh, what if it comes back and like I'm riddled with endo? Never know, right? So that to me was a huge win. And I'd love to just say, everybody's results will vary because we're all on our own different health journeys. But I was like, I was kind of like doubting myself. I'm like, really? Like, this is 13 years post excision, and I was able to obviously maintain good post-op results. So I was absolutely so stoked with that. And um, I'm going to be talking to the head radiologist about, his technique and why it's so accurate, because he says that because with this type of MRI imaging, the technology that they're using, they're doing like millimeter imaging. So anything as small as 1 millimeter will be picked up. Uh,
Mm.
so it's pretty precise. It's probably more precise than an inexperienced surgeon doing a lap. You know what I mean? That can miss things, which we
Yeah.
see a lot, which we see a lot, don't we?
Well, we do. And I think this is a really important conversation to have, especially because, the textbook gold standard for diagnostic and removing or understanding how the endo is present is laparoscopy. However, that's changing. And having this information is so phenomenal for people who don't want to go under the knife straight away or who are looking to maybe go down that journey or that path of getting an endometriosis diagnosis. But I guess when we're looking at diagnostic imaging, when we're looking at MRIs, when we're looking at laparoscopy, do you still think laparoscopy is gold standard, or do you think now with these imaging
Well,
techniques,
this
it's
is the thing. This is why I'm so excited to speak to Dr. Zane because, like I said, what's the skill of your surgeon? Like, is he going to miss millimeter lesions because they're inexperienced? It's almost like unless you have an excellent endometriosis excision specialist, the MRI might be more beneficial and effective in detecting for diagnosis. Of course, for removal and excision, that's a whole different story. But yeah, I'm definitely on the fence about that now. So
Mm.
yeah, I'm also very excited to hear all about the detail of his technique and why it is so accurate. Because when you go into the clinic, have you ever been to Mermaid Beach Radiology?
No, I've never been. So I'm fascinated
Yeah.
because I now want one because I still am symptomatic, and that's why I'm fascinated to hear your journey. So yeah, fill me in
Yeah,
about
it's so like, firstly, the clinic is super cool and they make it totally not like a non-medical experience. But huge TVs all over the place saying like, did you know laparoscopy is no longer the gold standard for endometriosis? Get our 3T MRI for endo, high accuracy, this and that and everything. So they're definitely like putting it out there
that.
that yeah, this can diagnose your endo. So it is very, very cool.
It's so cool. So where can we find these specialized imaging clinics? Because they're few and far between. And
Yeah,
that's the issue, working in clinical practice. It's like, okay, great, we've got one here on the Gold Coast and you had to travel 10 hours to get here. But
yeah.
what about people in major cities, rural, is this something that we need more money invested into so we have these techniques or that are they everywhere?
I think this particular radiologist is just a total like tech geek and wanted the best of the best of the best. And you'll see if you do ever go into his clinic, it's pretty cool. But an MRI is not an MRI when it comes to endo as well. And I'm gonna ask him because in the US, my patients get a rectal and vaginal gel inserted into them with the MRI.
Mm.
Whereas this technique, I was given an intravenous contrast dye given to me so that the lesions would light up wherever they are. So they looked from my diaphragm all the way down to like my hips, basically. Um, whereas I'm not an imaging specialist whatsoever, and I am going to ask Dr. Zane this, but what exactly does the rectal and vaginal gel do for imaging that, why would you not give the dye? Because it just would make more sense to. This is the thing, like there is no standardized care and diagnostics for endo, which makes it so hard because you're totally at the mercy of where you get referred, where the system leads you. And here in Australia, you and I both know that the public system is pretty shocking when it comes to endo.
Yeah, it's terrible. It's
So
terrible. And I think that's why, you know, you're so obviously so vocal in it on social media. I'm not as much, but I, especially in clinic with my endo clients, it's finding that right care that will make your endo journey a success or not, or not success,
Yeah.
that's the wrong word, but if you're not getting the right surgeon or the right diagnostics or in the right place, it could really dictate your trajectory of your endo journey and
Oh
your
yeah.
method.
Oh
Yeah.
yeah. Especially if you live like regional, for example. I did an endo meetup where I live, and there was this poor woman who had been through this public system, and she ended up getting surgeries that resulted in severe prolapses.
Oh, gosh.
So then she needed to like get prolapses fixed and hysterectomy, and it's just awful, 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 awful stuff. So yeah, we definitely need better care from the top, as in like from, I don't know, the medical institutions that are teaching future OBGYNs and surgeons, you know?
Yeah.
So it's
Yeah.
heartbreaking, some of the stuff that people go through.
Yeah.
Um,
Yeah.
yeah,
Yeah.
yeah.
We see it all too much, don't we? And that's the thing when I have a new client coming in presenting with endometriosis and they tell me their story, I wish I was shocked by it, but I'm not because it's so common with the prolonged diagnostics or diagnosis of endometriosis and what they have to go through, the hurdles, the amount of trauma they have to go to get to, you know, where they are right now. It's
Yeah, yeah, yeah. And that's why I'm so excited about this MRI tech that's emerging because, it is so non-invasive, and it's like an hour of your time, and it could be life-changing for someone. For example, let's talk about the sad stories we hear a lot of: silent endo, stage 4, infertility, IVF. You
mm,
know,
mhm.
people with active endo going down the IVF path and not getting investigated properly. It's like, wow, these drugs are going to make your endo worse. Um,
100.
so yeah, yeah, it's hard. It's hard. I'm very passionate about it, if you can't tell.
That's why we love you in the space. That's why we love you in the space.
Hey, speaking of IVF, I liked your post last night, by the way.
Thank
It
you.
was a huge share. Do you want to tell us a little bit about that?
Absolutely. This is the first time I've been public about it. So, and speaking, you know, having endometriosis, I've had two laparoscopies in the last 2.5 years, which is quite phenomenal considering how deep and infiltrating my endometriosis was on my second surgery.
Oh
Uh,
yeah.
I guess I'll give everyone here a little bit of background just so they can see what's led me to now IVF. So I think postpartum, you know, postpartum, I had my beautiful daughter. Postpartum, my period started to change a little bit. I always experienced extremely painful periods. That was always part of my journey, but never heavy bleeds until postpartum. And it wasn't until I think my third postpartum period back, I thought something is really wrong here. Something is wrong. And I am not leaving like my GP until she gave me a referral to a gynecologist. I knew in my gut I had endometriosis, but I wanted to have a laparoscopy. So I went to, I'm not trying to be sexist here, but I will be because it's so important for my unique picture. I went to a male gynecologist. He said, yeah, let's do some investigative surgery. So I had a laparoscopy, diagnosed me with a stage 4 endometriosis. It was absolutely everywhere on my bowels, bladder, rectum, pouch of Douglas, in my uterus, around my ovaries. It was quite profound. Um, I was led to believe that it was all excised. I had complete excision surgery. Then a few other little health journeys along the way happened, and then I still was so symptomatic, so symptomatic. And we weren't falling pregnant for our second baby. So I met a new surgeon, thanks to you, and really trusted her straight away. And she said to me, I believe in science first, but I believe in your gut instinct second. Because I said to her, I know I still have endometriosis in me. I just really want you to do another laparoscopy on me. So she did. She did. And she, you know, basically said, you have stage 4 deep infiltrating endometriosis that is so prolific. We had to cut into every single muscular tissue and we're on the outside of your organs to remove it. And that was huge in the space of, that was 2 years at that time, understanding that my previous surgeon didn't do anything. Yeah.
The IE doesn't grow like that in a couple of years. That stuff grows over, years and years and years, decades.
Decades. Yeah.
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 Mm.
So what was great, he obviously had removed superficial endo because there was no superficial endo there. So nothing had progressed in that probably 2 years. But I think the nuances of the surgery itself, maybe he left it there because he wasn't experienced enough to actually remove the lesions, which maybe I am grateful for. Looking back in hindsight, I don't want some inexperienced endosurgeon removing endo with an untrained eye. So I think I am grateful for that. But having that surgery, that was only in, when was it? June or July last year, 2024. My recovery was pretty brutal because I lost my bladder froze, and I lost the communication.
Yeah.
Yeah. Yeah. So I lost all communication from my brain to my bladder. I was in hospital longer than I had anticipated and had to basically retrain my mind to say, you are safe to urinate. And that took a long time for that to happen. I had catheters in, I had to do all these tests to measure my urine output, for them to send me home. It was quite terrifying because I'd never been through that before. And I still to this day always think about it when I go to the toilet and urinate. I always think, have you emptied your bladder, Katherine? Because it was such a focus,
Yeah.
like a PTSD
Yeah.
situation. And really interesting on this IVF journey, I've had those similar signs and symptoms appear. And I don't know if it's psychosomatic, but I've been really focusing on emptying my bladder still. And that's 6 months later. So watch this space. I'm not quite sure why. But yes, started IVF with my endosurgeon. So the reason I chose her for my IVF journey is because she knew the absolute ins and outs of my endo surgery. She knows my history. I didn't have to sit there with some other new fertility specialist, and go through everything that I've been through. So she could really tailor my medication based on my estrogen levels and what that looks like. And especially, like you said, we know IVF drugs can make endometriosis worse. However, I had complete excision surgery 6 months ago, and we can feel really confident, that my body is in a really good state to go through the IVF journey as well right now.
Yeah, good. And how has it been?
It's been, I said to my husband, I think I said to you, I feel like I'm in a movie and I'm watching the movie, but I'm the main character. Yeah.
Yeah, right.
It
Wow.
feels like a complete out of body experience. And I've gone through so much since that first injection. I've been through a whole stimulated cycle now. And I'm really proud of my body. I was really fearful of hyperstimulation because I am an estrogen, estrogen dominant person. I've always had high estrogen, and obviously having endometriosis, that's extremely common. But my body, I had no hyperstimulation. I responded really well to the medication. Yes, I had signs and symptoms of bloating, breast tenderness, emotional roller coaster, irritability, all of those PMS signs and symptoms because I haven't had hormone medication ever like that in my life. So that was all, I was all very prepared for that. But even today, after my stimulated cycle and egg collection, which was a week ago today, my body feels pretty good. Like I feel really good. I don't have fluid retention. My breasts aren't sore anymore. My bowels are working really well now.
That's
Um, and I feel really energized and well. I feel really energized and well. And I think that's because of all the preparation I have been doing for my endo management to lead me to this point in time. Yeah.
yes, that's so important. Like I say to patients, regardless of if you fall naturally or we end up supporting you through IVF, what we're going to do is not going to go to waste. All the gut stuff, all the nervous system support, everything else that comes in the way that we need to look after you as an individual will not go to waste, regardless of how you decide to proceed on your conception journey.
Exactly. Yeah. Yeah,
Yeah.
and I think when you're looking at the disease of endometriosis being a whole body disease, like you were saying, you have to really put the work in to reap some of these rewards on the other side.
For
And
sure.
and I couldn't see it at the time, but now that I've gone through a whole stimulated cycle, my body, I'm so proud of all that work that I've done, especially mindset work, 100%, but physical work, and immune system work as well. It's been
Well,
really important.
all of it. And I say to people, I'm like, guys, we've been dealt a pretty bad hand with endo. We just have to accept it. So if you want to, you know, thrive as best as we can with endo, we need to do the things. Like, unless you want to be completely at the mercy of the medical system, which right now can only offer us repeat surgeries, hormonal suppressions, and other forms of pain relief, then we have to take it on ourselves to do something. And I feel like that's quite empowering and not defeatist at all. What do you think?
See, I think it's empowering. However, my journey, like you know, Kim, but I'll explain to everyone else, I am still very symptomatic.
Yeah.
And when I had my 6 month follow-up from my lab, my surgeon, who's my fertility surgeon right now, said, you are in the 10% of endometriosis sufferers that excision surgery doesn't work for.
That's so wild and awful.
Yeah, so that's wild and awful, even though I put in all this work, I
Yeah.
do all the things, and I've still experience period pain. I still experience, heavy menstrual bleeding. It's definitely reduced and I can manage it. It's nowhere near as bad, but I didn't get a complete change in my symptoms from this. And that's something that I've had to really lean into from an emotional perspective because that just sucks for me. That sucks that this is it. It's like, cool. She said I probably wouldn't even do any more laparoscopies on you. I think they are a waste of time unless your symptoms really are exacerbated and we need to remove any endometriosis like lesions or whatever else we find in there. But she said, you are the 10% that might respond to hormone suppression. And you know me, that's never going to happen.
And you know what? I posted this post the other day because I came across some really fascinating research around a term, the endo brain. And I'm
Mm.
just mind blown by this, but kind of not surprised that in patients with endometriosis, we have different, literally, the architecture of our central nervous system can change as a result of endometriosis. So that has me thinking about people with stage 4 and who are asymptomatic, and then people like you who've had it completely removed and are still very symptomatic. So
Mm.
isn't that fascinating?
Mm.
There's still so much that we don't know about endo.
So much. Can you explain to some of the people in here what that was looking at
Yeah,
specifically?
so the study found that people with endo had changes in the brain in, I'm going to pull it up real quick, in the way we perceive pain, um, in the way, so the um, pain processing areas of our brain, the emotion and pain integration areas of our brain, and the memory and stress responses, and the emotional regulation aspect part of our brain.
See, the memory and stress responses really intrigues me because I think about so many endometriosis people who suffer with the pain. And because we've been so used to these pain cycles for
Yeah.
decades of our life, there has to be some type
It's
of,
really,
yeah,
yeah, it's that really strong neuronal pathway that's been so just reinforced.
reinforced,
by
yeah.
those sensations. Um,
Mm.
I've got a girlfriend who's a naturopath, and she is now officially a neuroscientist. She's just completed a master's of neuroscience, and she is an absolute brain nerd. And I just sent her this, and I was like, we need to do a live and we need to talk about this because this post has just received so much interest and so much traction. And it's such an under-researched area. So I would love to talk to her about like what these areas of the brain specifically do and how, because she knows endo in and out as well. It's just so fascinating. But I, yeah, I would love to scan like how cool would it be if we could just like scan everyone's brain and see, the changes in these sections and potentially how this could be feeding into the symptoms. Like it's almost like phantom limb, where you no longer have it there, but because of your brain, you're still feeling those sensations.
Yeah, absolutely. And even how we respond to some pain medications or natural pain support versus other people with endometriosis as well. Like I look at the pain pathways and the sensitivity and how the brain's responding to that. And I find it fascinating because there has to be a neurological link that is driving the pain sensitivity. There has to be, like in terms of like the nuances from decades of pain with
Yes,
chronic
yeah.
pain. Yeah.
Yeah. So what it was finding was the brain pain connection is that basically your brain's pain processing system becomes highly sensitized when you're living with endo. And the persistent pain signals, like what you're referring to, actually change how your brain's neural pathways work, creating lasting adaptations in your central nervous system. So some of the documented changes include altered pain processing networks.
Mm,
And I would have to talk to my neuroscientist friend and delve deeper into these pain processing networks, modified stress response patterns, enhanced pain signal transmission, and disrupted pain inhibition pathways. So it's almost like your brain isn't inhibiting the pain
mhm.
pathways. So
Yeah.
that's just like our default. Um, isn't that just fascinating?
Yeah.
Imagine if treating endo becomes like a brain thing eventually.
Yeah.
Manage like working on the brain.
Yeah.
Um, it would be really fascinating to see if there were like specific herbs that inhibit these pathways, or you know what I mean? I just
And
love to delve into that.
even, what if like even somatic things and I'm thinking hypnosis, I'm thinking all different areas that we could utilize from that.
Sound,
Yeah. Yeah.
frequency,
Yeah.
everything.
Yeah.
Yeah, literally changing your brain, neuroplasticity. So yeah, it's an area that I am absolutely fascinated with now and also the neuroinflammatory cascade. So the inflammatory nature of your endo will result in these inflammatory cytokines, chemicals that can cross your blood-brain barrier. So things that shouldn't be crossing into your brain do get into your brain. So it's almost like inflamed. It's like the leaky gut, leaky brain kind of thing, but inflamed endo, inflamed brain. And so you could just imagine it just lighting up these pathways that increase pain, increase sensitivity, and decrease pain inhibition.
Yeah, fascinating, fascinating.
So
Watch,
fast.
watch this space.
Yeah, for sure. Um, but
Ian, what do you do to manage your endo? Fill us in because your story is phenomenal with how,
it's
you've only had one excision surgery. We don't really hear that. We hear of multiple excision
I know
surgeries.
I was so blessed. Gosh, my story is so long. It took me 12 years to get a diagnosis. I was so sick in the last year of the it was like a year-long flare. I was in Melbourne actually. You know how many times I was in that Royal Women's Emergency Department? I was like in one of the best women's hospitals in the country. And I just got slammed with so many misdiagnoses. And the biggest thing that I don't really talk about this much actually, but the biggest diagnosis that they were like adamant that I had was pelvic inflammatory disease. I was
Yeah.
on so many rounds of antibiotics. I did
Mm.
not have chlamydia. I did not have gonorrhea. I had like a uniquely presenting PID. And they're like, yeah, some people who had PID, um, will have chronic pelvic pain for life as a result of the PID. And I have my report from my surgery, and my doctor wrote on it like no PID. There, I had no PID the whole time. It was wild. I woke up from it. I was just like, oh my gosh, do I have PIDs? Like, no, you have endo. I was like, wow. It was just crazy. So many misdiagnoses. And I'm a very different person now because I'm on the other side. I'm still dealing with a whole lot of other chronic stuff with the POTS and the pelvic vascular stuff, but I do still very much understand the chronic endo journey. And then after that, he was like, oh, I was very blessed to have access to such a good doctor. He's probably one of the best in the country, if not the best. Like, he's called the doctor's doctor when it comes to endo excision. I don't know what he's like these days, but
I've sent some clients to him actually.
have you? Yeah,
Yeah.
it's just I was in uni. I just finished uni, and my housemate, her dad was an OBGYN, and he happened to be visiting. And I'd been telling him like how sick I was. And he's like, has anyone mentioned endometriosis? I was like, no. He's like, you're not my patient, but he was the one that ended up referring me to this specialist. Like, I wasn't even his patient. And I'd seen that many doctors and been to emergency that many times. And it wasn't until he came for a visit that he referred me. And anyway, feel blessed that I was able to see someone so good. But I think the best excision you can get makes a world of difference. You know, I wonder, like, if, I'm not even going to delve into it, but we see a lot of botched surgeries, firstly. Yeah.
Yes.
And then he was like, let's put a marina in during your surgery. I said, no, I don't want to do that. He was thankfully very open to alternative therapies, but he continued. I had a script for opioids because um, it was the thing that worked the best with me, basically knock me out, and then I won't feel the pain. But I couldn't function like that. So as soon as I got my diagnosis, I was straight onto it. I was straight onto it from a naturopathic perspective, diet, lifestyle. But I worked with a traditional Chinese medicine doctor who gave me herbs and acupuncture, and that was great to incorporate into naturopathy. And I had my first baby. I became pregnant with my first baby 6 months after that surgery, which was wild, and super, super cool because it was just about getting everything into alignment, like once you calm down. I know it's making it sound easy, and I don't want to sound insensitive given what you've gone through, but yeah, dampening that inflammation, ensuring hormone balance. I was a lot younger also. I was like a spring chicken. I was like, what, 23, 36 now. So yeah, 13 years ago, a lot younger, fresher eggs, you know?
Beautiful fresh eggs.
Yeah, exactly. So it was a lot easier to fall pregnant because of age. And then ever since then, it's been a refinement of diet, of lifestyle. After my son gave birth, I became very ill with POTS during that pregnancy. Very, very unwell, very traumatizing phase of my life. That's when I delved into genetics and realized I had histamine intolerance. I have all these genetic mutations for, glutamate and histamine and MTHFR. And this was before MTHFR was still a buzzword. This was before, I think, oh gosh, I don't know, Dr. Ben Lynch had already launched Seeking Health or
Yes.
not. But it was when 23andMe had just started making, and were you working were you Fit Genes or Smart
I'm
DNA?
Smart DNA. I was working with Smart DNA. Yeah.
Yeah, it was back in the early all of that. Yeah. So I really started to delve into all that. I remember on my low histamine diet, and I say this to patients all the time. I will never give you homework to do something if I personally haven't had experience with it and can do it too. So I was on this crazy low histamine diet because I was so reactive. It was postpartum. My body was just like not okay. I was down to like 10 foods or something wild like that. Um, just for a season. Obviously, we know that we need to heal and work with foods to heal and increase tolerance, but at one time I was so reactive to things. And that was the mast cell, histamine, endo. And my endo symptoms were so bad after my first baby. I had a Facebook memory pop up not long ago, and it was like, 2015, the end of 2015, my baby was probably 6 months old, and it was like whoever said that pregnancy gets rid of endo is a big liar or something.
Yeah.
Wasn't like Instagram like there is now. And I had heard things like, "Oh, you'll be so much better after pregnancy." And I was so bad, like really, really bad. And I thought endo had grown back. I actually saw a surgeon in 2017 to prep for another lap. I never went through with it, but like obviously, I've come a long way since I now have what I call dream periods. I don't want to rub anything in or sound insensitive, but they catch me by surprise. Um, Bleeding is very, very minimal. I do get that a little bit of that heaviness, which I now know is very classic pelvic vein. It's that pelvic congestion syndrome. Um, and yeah, so I do a lot of things. My kind of go-to is a low histamine diet when I need to pull things right back because of the histamine estrogen link. I've done a whole lot of different estrogen detox type of things. I always try and keep in the forefront of my mind because now I know my genetics. I know what I'm predisposed to. I know where my weaknesses are. I know that I'm always going to have to be cautious of endocrine disruptors and toxins, which everyone with endo should be anyway, regardless of what your genes say. Methylation, because of my MTHFR gene mutations, my histamine is not going to be breaking down effectively. So a low-ish histamine diet. A whole other host of things, but it's just been this refinement. But something that's been quite good is nutritionally balancing your fats, your essential fatty acids. And I know we talked about this, but getting your omegas in range, your omega-3 is actually one of the most robustly researched nutrients that we know can assist in bringing down systemic inflammation. Now, talking about the brain stuff in endo, we know that, our brain is a whole different thing, but bringing down the inflammation in your body through nutritional means by balancing your essential fatty acids is something that we know works and can happen, regardless of whether you interpret it as pain or no pain. The inflammatory markers will speak for themselves. So this is something I do in clinic. I know you recently started doing it in clinic too. And I was wondering if you wanted to share your test results about this.
Well, yeah, I mean, you can interpret them because this
Yeah,
is
yeah.
all I'm
So
happy for you to share them.
yeah, so basically, generally speaking, globally, with the modernization of food and agriculture, we are eating far too much omega-6
Mm.
and nowhere near enough omega-3. And if we're dealing with these chronic illnesses, inflammatory pathways and inflammation is the absolute driver of so many chronic diseases. So by ensuring that our omega-6, omega-3 is in ratio, not only that, but that, our omega-3 index, so our omega-3 levels are nice and high in their ranges, this will absolutely help to dampen those inflammatory pathways. So just as an example, when we first tested you, your inflammatory, should I share my screen?
Share screen, show everyone my results because I was shocked because obviously I'm a clinical nutritionist, so I work on my fats from a dietary perspective, day in, day out. I'm very regimented with my weaknesses and my predispositions to endometriosis and how that helps. And an essential fatty acid rich diet is really important to me. And my results are absolutely shocking. And that's just from a norm, like that's from a whole foods diet. That's from a whole foods diet.
It's wild, isn't it? So this is, and I want to talk about why. I want to focus a little bit on the why. So the
Feel
first thing
that
you can
range.
see is that your omega-6 to 3 ratio is 16 to 1. Like there is no shame in sharing this, by the way, guys. It is just something that I see day in, day out in clinic. I test this all the time. It is very hard to keep omega-3 stable in your body because they are very sensitive fats. They oxidize really, really easily. And I'm going to talk about why, most algae oils, if you're vegan, or fish oils just don't withstand the oxidation. And especially if your body is, if you've got something like endo and your inflammatory pathways are upregulated, you're going to be more prone to oxidizing your fats. So Omega-6 to 3 ratio should be 3 to 1 or less. So at 16 to 1, that's way too high. That's going to mean that your protection, so omega-3s help protect from inflammation. That's going to significantly deplete your protection value. I'm not going to go through this in too much detail, but we look at omega-3 index, your mental strength, cell membrane fluidity, and arachidonic acid, plus a breakdown of everything. So ideally, you should be 3 to 1 or less. Protection value, insufficient. I like it above 90. Closer to 100 is better. And that is because omega-3 is low. So we'll get to that in a second. Your omega-3 index, so if you do click learn more here, it can tell you how these are calculated. But your omega-3 index is important because it looks at two very well-researched omega-3 essential fatty acids, EPA and DHA, which are together count towards your omega-3 index. So I always say in women with endo, I like it around 10 because you want that extra, you want that extra anti-inflammatory support. Mental strength. Okay, this is included as a biomarker because we know that DHA, a type of omega-3, has been is actually part of your nervous system anatomy. It helps to kind of insulate your nerve cells. And if you don't have enough DHA around, it can impact the way your central nervous system functions, but it's also been researched in relation to mood and cognition. So we want ratios to be in the green. So this one actually wasn't bad, although you were kind of close to the red. It's the only yellow we had. I think everything else was red. Um, Cell membrane fluidity. I love this because people may take a whole bunch of supplements, but how are we absorbing these nutrients into our cells? So thinking about the cellular level, your cell membrane fluidity is determined by what sort of fats you have floating around for your body to use to incorporate into your cell membrane. Every single one of your trillion cells, the cell wall or the cell membrane is made out of this like phospholipid layer, which is essentially made out of fats. So if you've got too much omega-6 floating around and not enough omega-3, it's going to be using that omega-6 to make your cell membrane, which then results in a rigid cell membrane, not a fluid cell membrane. And nutrients can't enter in easily. Waste can't exit easily. So if you're taking all these supplements, but you've got a really rigid cell membrane, you're not going to be as effective at utilizing these things. So we want a nice fluid cell membrane.
I explain this in layman's terms to my clients. I say, we want your cells to look like nice plump grapes instead of dried up shriveled sultanas, and this is this entire process right here.
Yeah, yeah. So then you can actually like absorb and absorb nutrients and get rid of waste, basically. So that is really interesting. I love that, this as a foundation, our cells should be omega-3, like no, not 16 to 1, obviously still higher in omega-6 compared to omega-3, but triple, not 16 times, triple as a maximum. There's this presentation I was looking at, and it looked at history, and apparently we are like our genetic and our DNA functions best at 1 to 1 ratio.
Oh,
Surprising, really.
yeah.
Arachidonic acid is a type of omega-6, and this is very interesting because when we're looking at endo, your arachidonic acid is a fat that kind of stimulates or triggers a lot of inflammatory pathways. So when you take an NSAID medication, like a paracetamol, for example, it actually blocks certain enzyme pathways that are upregulated by arachidonic acid. So you want to make sure that your arachidonic acid is in the green to not upregulate those inflammation pathways. Yeah, so you can actually download the reports there, but this is also really interesting. So when we look at your omega-6, so this is your target range, this is your values, and this will show us whether you're negative, positive, or in range. So if there's a negative, it says you're deficient. If there's a positive value, it means you're over, but at 0, it means you're in range. They're actually not that bad. So if you look at them, they're not like super, super over. Arachidonic acid is just like slightly over at the top end, but it's because your omega-3 is so deficient. Have a look at that. So they're all really negative, and your EPA was negative 80.8%. So that is huge. So we're
And we need to preface, I was taking a practitioner grade fish oil at the time of this test.
Yes. So you're probably wondering, like, what on earth was going on, right? So omega-3s are very sensitive to oxidation. They will oxidize. In nature, fish eat seaweed. The omega-3s in the seaweed, it's bound. It's bound to something called a fluorotannin, which is a polyphenol. It's an antioxidant. It prevents the omega-3 from oxidizing. But we don't want omega-3s, which contains heavy metals and toxins. So it undergoes quite rigorous processing to clean it up. But in that process, it unbinds the omega-3 from what it's protected with. So it makes it more prone to oxidation. If you are taking a fish oil, have a look at the back. It may have something like rosemary oil or astaxanthin or vitamin E, but there's actually studies showing that these antioxidants compared to fish, combined with fish oil, like a cod liver oil and vitamin E, for example, oxidize quite quickly. So they get absorbed. They get absorbed into your tissue level, and then they're oxidizing, but they're not getting incorporated into that cell membrane, which is so interesting, which is why that cell membrane is still rigid and not fluid because the omega-3 is not getting absorbed into your cells. So the study showed that and I love this because I love the concept of the Mediterranean diet, fish and olives, best combo. So olive, really high quality olive oil with super high dose polyphenols protect the omega-3 for up to like 35 hours or something. So this is what we use in clinic. This is what you use in clinic. It's been amazing for me personally. I use it for my family, but I love testing people because it's like, oh my gosh, I'm on a practitioner omega-3 and I am so EPA deficient. I am DHA deficient. I'm not absorbing it, and my ratios are totally out of whack. So,
Yeah.
thank you for sharing, by the way.
I think it's so good to see because, even someone like myself who is so regimented in what I take and do and thought I was doing all the right things for my body. And I was on a practitioner grade fish oil that had the rosemary extract in it, which is a really common one in this particular brand. And you can clearly see how my body is not absorbing it. And
Lot
this
of
is we're looking at the nuances of the inflammatory cascade and those pathways. We have to be, especially with endometriosis, we have to be really specific with what we're using. And with
yes.
endometriosis, food, unfortunately, sometimes is not, it's not penetrating the cells like we want it to. Also, food in its whole form is fantastic. But I was eating all the avocados, I was eating all the things. And you can still see here how deficient I am in omega-3. It's quite astounding. Yeah.
It's crazy. And also it's because a lot of high omega-3 foods contain a lot of omega-6 as well. And omega-6 is like snuck into everything. It's snuck into like everything. What is it not in, you know?
Yeah. Yeah.
I have a practitioner friend in the US, and she is a women's health pracky too. She deals a lot with endo. Look at this test. This is wild. Can you see this? She sent this morning. Let me know when you can see.
52 to 1.
This is probably the highest I have ever seen it. Isn't that wild?
I thought mine was the worst. Well, that makes me feel a bit better.
I 46. I've had a 46, but I haven't had a 52. She sent this morning. But look at that. Test two, 5.2 to
Yeah.
1 by using a combo of high dose olive polyphenols
That in
and
3 months? How long was those tests?
yeah,
Do you know?
about 120 days. Yeah.
Wow,
120 days. Yeah.
120
So,
days.
so isn't that fascinating? So
Yeah.
as we know, whether or not your brain interprets it as less pain or not, that inflammation is going to be settling so much by getting these levels under control.
Yeah, I've actually got my test to redo my markers so we can
Oh,
have a
yeah,
look
so
and
curious.
see what is going on.
Anyhow, should we open for a Q&A? I want
Yeah, let's do
everybody
it.
to do you guys want to use the chat? Oh, we've got a message in the chat. If you want to ask anything, um,
Oh, yeah.
sometimes we need to come. If you guys have any questions, feel free to actually just unmute yourself and just jump right in. What does this say? Sometimes we need to come back and work on how the brain and nervous system interprets pain. Things like pain reprocessing therapy, hypnosis, memory repatterning, and consolidation trauma therapy. It's such a multifaceted journey. I definitely not just surgery and nutrition. I wish, and that's what I'm fascinated by, Stephanie. I am absolutely fascinated by this. I think, Katherine, that's what you were trying to get at before, but this is definitely not my expertise. So I'm like, oh, I'd love to learn more about pain reprocessing, like just breaking specific neural pathways and establishing new ones for pain. Or
Stephanie, do you work in this area? Is this something that you know much about? I'd love to pick your brain if
yeah.
it is.
Hi.
Ah,
No, I don't work in this area, but I've done a lot of brain retraining and nervous system programs over the last 5 or 6 years. And yeah, the last 18 months has been really deep on pain reprocessing therapy and working with like a somatic therapist as well. So I've been trying to avoid endosurgery for 6 years,
oh,
but I think I've come to a point now where I need to do it. I need to get the excision done because I've got endometriomas and para-ovarian cysts and there's stuff going in there that I think I should probably remove. And I did see a very energetic naturopath too, who's like, if you remove those, it removes certain frequencies from your body, which then allows your nervous system to have more capacity to actually heal. And I thought, oh, that's really interesting.
I think that that's something I love all of this. And I wanted to ask you, Stephanie, doing all the hypnosis and the reprocessing, pain reprocessing therapy, has that helped you to a degree, or how are you managing your signs and symptoms?
It helps at different points in my journey.
Mm.
So I think like I've just moved and left a relationship. And so when I was in a relationship, no amount of therapy, no amount of anything was going to kind of cure how terrible that relationship was and how it was impacting on my symptoms. And so having moved, I can see that that's helping a little bit. And when I feel like I'm living my true self, then the symptoms are less too. So it's such an emotional thing for me.
oh, so such a good correlation to make, and I totally agree with that. You can't heal when you're in like on guard all the time.
Yeah, exactly. Sorry, I've just got a whippersnapper outside, so I keep muting.
No, thank you for being so vulnerable and sharing that with us, Stephanie. Yeah, I appreciate it.
That is so interesting. I never delved into that. And I was just pondering, I got pregnant pretty quickly after my excision. And I wonder if that break from endo pain, I had other pain now that I know I have like EDS. I had severe like joint pain and pubic bone pain, but not the endo pain. I wonder if that like silencing and lack of and just absence of the pain for a while was foundational for maybe, I don't know, brain stuff. I don't know. I don't know. I'd love to pick my neuroscientist friend's brain all of like in and ins and outs of all this, but um I wonder. I wonder. I don't know. So much to be studied, so much to be learned.
I think about this is totally off topic, but bringing back to endo, when I conceived Sunny, my daughter, so I obviously had stage 4 endometriosis all in my body because I didn't know at the time I had endometriosis. And it took me 12 months to conceive her. About 6 weeks to falling pregnant with her, I had a colonoscopy, right? So when we're looking at the gut microbiome connection and we're looking at we're seeing so much more research in this area from a dysbiosis perspective. I always ponder on the thought, maybe there was something in the complete flush out of my microbiome. I was working on my gut health a lot at the time as well, that, maybe that created an environment that my uterus microbiome may have responded differently too. I don't know. And like I would never know that. But just pondering on all those little thoughts that we have now because there's more research coming in, and it just makes me think a little bit more outside of the box.
That's so fascinating. And were you getting the colonoscopy for the GI symptoms associated with bowel endo, you think?
Yeah, I've had, gosh, over the years, I've had about 4 colonoscopies because I experience really chronic constipation. As you know, Kim, that's my default. That is my default sign and symptom. If I stray a little bit from my usual food, I will be chronically constipated. So I always have check-in colonoscopies. And I actually pushed for a colonoscopy before I started my IVF journey because I thought in my head, oh, well, I'll just do exactly what I did before I conceived Sunny because maybe there was something to that, even though, my gut health is pretty okay, but I am much more susceptible to dysbiosis. I'm much more susceptible to small intestinal bacterial overgrowth, so SIBO, and leaky gut, obviously, as well. So I was just thinking about that. I was reflecting about that the other day. Yeah.
You know what? We'll probably never know.
No, we won't.
Oh, got something here from Jasmine. Jasmine, all right. Hi, wanted to start by saying thank you so much for this session and for sharing your journeys. This has been so enlightening. I'm currently on a progestin medication to manage my endo symptoms. It's been amazing in the sense that I have no more periods and no pain at all. But as I would like to embark on my pregnancy journey at some point down the road, my question would be, what would be the top things you would start doing now to be proactive in trying to help reduce symptoms once off the meds? Katherine?
There's a lot here. First of all, thank you for your question, and super exciting for you embarking on the pregnancy journey. For me, with anyone starting to conceive, and this is my kind of specialty in the clinic, in my clinic, we start with the gut. We start with the gut. I really look at, okay, if we could look at, most people say 3 months prep for conception. I say if you can give me 12 months before you start trying to conceive, especially with endometriosis, that is phenomenal because there's so much work we can do to get your body as prepped and as primed as possible for a healthy conception. And not just a healthy conception, a healthy pregnancy and postpartum journey as well. So I would really look at, maybe working with a healthcare practitioner like Kimberly or myself, and really going into the gut microbiome first, because we eliminate our hormones from our bowels. Our bowels and our gut is basically phase 3 of elimination and detoxification. We need to ensure we have a healthy gut microbiome. We're decreasing immune system, basically decreasing inflammation, and we're really working with the immune system response so we can basically have this beautiful environment for implantation in the uterus microbiome too. So my first and foremost would be starting with the gut. The gut to me is the second brain. So it has its own nervous system, the enteric nervous system, and it's in direct communication with the brain. And especially with everything else that we've been talking about today, I think it's really important to harness a healthy gut microbiome and to create a beautiful diversity within that microbiome to support the uterus microbiome for implantation and beyond. So that would be my first, I guess, with coming off the medication, but there's a lot more here in terms of nutrient deficiencies and things like that we'd be looking at as well. Kim, why don't you share some of your tips?
Yeah, so I always say to people, if you are on any type of hormone therapy, your nutritional needs will change. So I don't know if you have been, supplementing with a good prenatal alongside this, what kind of diet you're eating, how you're supporting your central nervous system, stress levels, so on and so forth. So it would be a very tailored plan based on you and what you're presenting with and your age. I don't know how old you are. How old are you? And timeline. You didn't really specify there, but like Katherine said, working on your gut, and that would include, food, it would include lifestyle stuff, it would include all of the things that we mentioned before will affect your microbiome. And coming off the pill, you'd want to support your liver. Okay, so your liver is very, very important in modulating your hormone balance. Estrogen detoxification is phase one starts in the liver, and phase two, and then phase three, as Katherine says, relies on your bile and your gut. So we need to make sure, good liver health, and that could include herbal medicine. You probably wouldn't do it now, just in case it does speed up the clearance of your progestin medication. Which one are you on, by the way? So you would probably work on, I would just go robust food, nervous system, maybe adrenal support, all the nutrients for pregnancy, good levels of activated B vitamins. I love activated B vitamins, not in mega doses, like don't go hardcore with methylfolate and methyl B12, but just get the right forms of nutrients in you. Assess your thyroid function. Do you have signs and symptoms of any thyroid issues? Okay, Dianogest. Yeah, very, very common for endo. But yeah, it would definitely depend on you and your symptoms, because I see a lot of thyroid issues in clinic. Under functioning thyroid, hypothyroidism will worsen your endo symptoms. It'll make your periods more heavy, more painful, compromise your estrogen detoxification, and further drive your estrogen progesterone imbalances and estrogen dominance. Something that I do like using is bioidentical progesterone. I don't know. I can buy yours too. Yeah, bioidentical progesterone. So we only make progesterone from ovulation. And you don't necessarily make good amounts of progesterone just because you ovulated either. You want the event to be effective. You want to make sure that you've got the right cofactors in place, nutritional cofactors to make that progesterone. You want to make sure you're not too stressed so that your body doesn't prioritize your adrenal hormones over your progesterone synthesis. All these things are so unique and tailored to the individual, and a good practitioner will go through all of this with you. But essentially, gut, liver, nervous system, rule out thyroid issues, adrenals, toxicity is a huge one, huge one. Detox your environment, your food, your kitchen, your makeup, all of the above.
Gosh, it sounds very overwhelming, doesn't it?
That's what a good practitioner will take you through in due time.
And I also oh, sorry, you go,
Oh,
just.
no, sorry. I was just unmuting. Sorry. I'll let you continue after. I just want to say thank you. This is all really helpful. But yeah, I think I'm at a point where it's like, okay, where do I start? But I think working with one of you, like someone who can help guide and kind of take you through step and have like a personalized plan. Because I know a endo journey is like unique to each person.
Absolutely.
But this was very helpful.
Yeah, so nutritionally, I would also, before coming off Dianogest, I would want to make sure your omega-6 to 3 ratios in healthy range, just to make sure that inflammation isn't just going to bounce back really high. It's something that I said earlier, we can nutritionally target these things, get you eating an anti-inflammatory diet. It's basically like oily fish and good quality olive oil in a capsule or in an oil that you can take, which I love using in endo, and my endo patients will let you know that I love doing this test as well. But I'm glad it's been helpful.
Yeah, thank you so much. And it was also really enlightening to see, even if you're eating a completely like whole food diet, doing all the right things, and then you do testing and it's like it shows that, yeah, you gotta dig even deeper. So like I definitely need some help along this. But thank you. Thank you so much for the tips. And I'm Canadian. So just a question in general, do you take
I do.
patients
My
from
patients are from all over the world. I think Catherine's
Okay.
books are closed, though.
Yeah, my books are closed, so
Oh,
seek him. My books are closed.
okay. Okay, great. Okay, perfect. Okay.
Yeah. What were you gonna say? What were you saying? Just
Me or Jasmine?
no. You were saying something. I forgot. You were.
I was going to say, I guess another thing that I really look at, Jasmine, too, is testing and not guessing. When we're looking at hormones and coming off progestin and what your body's naturally doing when it's, ovulating, and when we're looking at that trying to conceive piece as well, we want to ensure that we test your hormones on specific cycle days. I'm very much into testing and not guessing in my clinic. I utilize a lot of tests for this reason in the fertility journey with endometriosis. just so we've got some baseline so we can see, okay, what progesterone amount are you producing after ovulation? Are you ovulating well?
Yeah.
Is that going to be protective? Because we know, when we're looking at endometriosis and resistance to progesterone, is that going to be a hindrance, or is that going to hopefully excel your trying to conceive journey as well? So, and obviously, if you work with Kim, she'll do all of that as well. But having a baseline of your hormones from just a simple blood test can give us so much insight. And then if we need to further investigate, I know Kim does these tests in her clinic too, looking at Dutch hormone testing so we can actually see the metabolites of your hormones, what they're looking like, how you're detoxifying them, methylation, and it brings in some other, like your adrenals as well. It can be really helpful if you've got time to really work on your health before trying to conceive. Yeah.
Yeah. Yeah. Yeah. Give yourself the time and the opportunity to do that.
And Jasmine, if you need a great prenatal, we
Yes.
ship to
Yes.
Canada.
Yes, please, because I started Googling and I went down this rabbit hole, 15 hours of looking up, and I've been afraid to purchase anything, but please, I'll take your recommendations.
Well, I have created one here in Australia
Oh,
because of this, being in clinic for over 9 years now. I saw the gaps, and especially living through these real life events of myself, I created, it's called Natal Support. My supplement company is called All Things Better. I have two supplements out in the market and we ship globally at the moment. But Natal Support is a beautiful blend of these activated Bs, your activated folate, high doses of choline, which we know is really important for conception and oogenesis. So have a look. If you find my Instagram, you can see the link there to All Things Better, but my prenatal is phenomenal. I will just toot my own horn there.
Yeah.
yeah, thank you. Okay, I will look it up. Thanks.
Cool. Samantha's got a question. Thank you both for sharing your journey. As someone who has just been diagnosed with endo via ultrasound and trying to conceive, can all of this improve chances of conceiving prior to a lap, or is it really dependent on where the endo is found? I don't think I really understand that question.
Yeah. Do you mean, do you want to do a laparoscopy, or do you want to start trying before you do a lap? And have you been diagnosed with endo?
Hello, so
Oh,
sorry that it didn't make any sense. Yeah, basically, I got diagnosed by ultrasound. I've suspected it for a long time, but I would say it's silent endo because I don't really have the typical symptoms besides gut issues. I don't know, like I'm very up in the air with doing a lap. I know it's unavoidable. But I was just wondering, like all of this stuff, like could it be helpful to fall pregnant now before I do a lap or yeah, if that makes sense.
100%. Like I said earlier, none of the stuff that you're going to do is going to go to waste.
Yeah, okay.
Looking at it from a holistic perspective, dampening that inflammation, ensuring your gut is well and healthy, your microbiome is balanced, your nervous system is looked after. So with my patients, I take them through 4 key pillars. The first one is hormones. Second one is microbiome, and that could be gut microbiome. It could be reproductive microbiome. We see a lot of reproductive microbiome issues, like BV, thrush, so on and so forth.
Yeah.
Immune dysregulation is the next big one. And that's where all your histamine stuff comes in. So we see a lot of mast cell histamine sensitivities in endo patients. And then the last one is, what did I say? Inflammation. Inflammation, immune dysfunction, hormones, and microbiome. So I always say to my patients, if you make good headway in these areas, these underlying drivers of your symptoms, it's almost impossible not to have improvement in your life, whether
yeah.
that translates to reduced pain or whether that be, better energy or better mental health, whatever it is, we can improve the quality of your life and better the outcomes for pregnancy, happier, healthier pregnancy and postpartum.
Yeah.
What
Yeah,
would
no, that's good. Oh, sorry.
I'm sorry, no, don't
No,
apologize.
that's okay. No, I mean, it's good to know because it's one of those things like, and look, my personal journey, I just, I'm told from an IVF perspective just to do IVF, but then I hear so much more about doing a lap first, and it's such a confusing journey. And like I feel like it's going to be unavoidable. They obviously say I probably have stage 2. I'm feeling like, hey, this is years of bad gut. I probably have stage 4. So yeah, it's just, yeah, I mean, yeah, I totally agree. Nothing will go to waste because it will improve.
Katherine
Yeah.
and my face are both scrunching up when we're
I
here.
know, because you would see this all the time.
No, it's just yeah. Go, 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 go take it away, Katherine. You have such a huge, long, like amazing story around like IVF and endo, but it will absolutely feed your endo growth.
Oh
Yeah.
yeah, yeah,
And that's the really devastating thing about this. And that's why when Kim was like, just throw everything at it, even if you've got this silent endo, just imagine walking away with improved gut health and improved elimination
yeah,
of these primary sex hormones too, which is obviously going to support your immune system as well. I think having that there as a starting point, it is obviously phenomenal because you're going to feel so much better regardless. But IVF drugs will worsen endometriosis if you haven't had that laparoscopy and that excision surgery. And that's
yeah,
it's just a sucky, shitty thing about it. And I think, even looking at my journey, that's the whole reason why I felt comfortable to do IVF now. And it's really
yeah,
interesting. I got interviewed by Marie Claire, a big magazine here in Australia, all about my endometriosis journey. And it's live. It's on the shelves. It's everywhere around Australia right now. I've seen it, but they interviewed me 3 months ago, right? And
yeah,
in it, I say, I'm never doing IVF. I'm not doing IVF. I'm not doing IVF. And just to see how much my mindset and your goals change, and you want to feel empowered in, I guess, every decision you make, because every decision you make is going to impact your health. Yeah,
yeah,
on a cellular level, on a hormonal level, and on an emotional level. So I think the more prepared and the amount of work that you do leading up to whatever you decide to do, lovely, I think is really empowering for you. Yeah. And your future baby. Yeah. And your future baby.
yeah. Yeah, no, I totally agree. And that's the thing, right? It's you never know. And I just hear a lot of people's stories and they've done the IVF and then the egg quality is poor and then they end up having a lap. But then there's also, okay, if I have a lap, is my IVF, if I go through IVF in 6 months' time, is it going to grow back because of that? Or like you, if you're in a good place, then I guess that would definitely help and it would help reduce the chances of it growing back.
Mhm. I mean, we can never guarantee it, but in my head, I'm like, 100%.
No,
Yeah.
yeah,
Yeah.
exactly. It
Yeah.
definitely puts you in a better position.
Yeah.
Yes.
Yeah.
Yeah, yeah,
Absolutely. And just going through this IVF, especially a stimulated cycle, just so recently, seeing how your body responds to that excess in hormone. My estrogen just before they did the egg collection was 3,900.
wow.
3,900. So when we look at that from a stimulated cycle, that is way too much estrogen, especially with someone who's living with endometriosis. So just imagine if I had the stage 4 endo there and how much that would exacerbate those
Yeah,
endometriosis-like lesions. And I feel confident because of how well I've pulled up that
yeah,
the lesions haven't grown back yet, because I think I would be feeling a lot worse and I possibly would have gone into a hyperstim cycle. So I think, yeah, the more work you do, just the better off you're going to go through that journey regardless. Yeah.
yeah. Oh, thank you for sharing. Yeah, it feels so good knowing other people are on this same path.
I feel you, girl. I feel you. Absolutely. Yeah.
Samantha, can I ask where your endo was detected during the ultrasounds?
It was on my right ovary.
Uh-huh.
Yeah. And then I reread it and it seems as though it could be stuck as well to my uterus.
Has adhered. Mm.
Yeah, so they told me it would only be stage 1 or stage 2, but the more I read about it, I really feel like that's like stage 4.
Oh,
Endometriosis?
yeah.
No.
Yes. Yeah. So yeah, and yeah, that was just, yeah, oh, it's okay. It's not going to stop you from falling pregnant.
Have you
I
had a histoscopy?
No, nothing.
Yeah.
Yeah, I just had a high cozy and it was picked up.
Mhm.
in an ultrasound.
I
Mm.
have a patient, a new patient this week who had a stim cycle and egg collection with an endometrioma present. She didn't know it was there, and they
Mm.
proceeded with it. And she was just like, yeah, not the happiest about it, but they were able to do the egg retrieval like around the endometrioma. But if you think about it, like that's like a chocolate cyst with so much inflammatory toxic fluid around your eggs. Like to me, it's just, I get it. I get why conventional medicine pushes it in people who wanted to get pregnant last year, right? They
Yeah.
just go for it. I have patients who are, in their 40s and went through IVF without a lap with stage 4 endo because the doctors were like, no, we'll just do a hysterectomy or give IVF a shot. And she went through multiple rounds. It's absolutely heartbreaking, failed them all. And then had to go through all of that and now is worse off. So if you have time on your side and age on your side,
Yeah.
do all the things that we mentioned, and I would highly recommend seeing an excision specialist, not a
Yeah.
not a blending.
I don't know if you like are in the position to recommend anyone, but I'm in New South Wales. Is there anyone that you know of that's
I think in Sydney there are a few good doctors, not off the
yeah.
top of my head though, but I'll have to
Yeah,
dig up.
I've got a list of some surgeons in New South Wales, but I can't remember off the top of my head. Whereabouts are you South New South Wales or North?
I'm southwest, so anywhere in Sydney is fine.
Yeah, yeah,
Yeah.
yeah. We might be able to help you with some surgeons there. I'll just write a note.
Thank you. I appreciate it.
You're welcome. Anybody else have any other questions before we wrap up?
Got a cyclone prep up here. That's mine
My
next.
gosh.
Oh,
Yeah, well, if no one's got any other questions, we will wrap up now, unless you want to say anything else. This has been awesome, by the way. I love just letting it flow and having these conversations and opening up for questions. Stephanie says, this is the pain and somatic therapist I work with. Thank you so much. Thank you for sharing that. I will look into her work. Appreciate it.
Me too. Thank you. And thank you for everyone who put their questions through and opening up. It's a vulnerable space. We're living with this chronic disease, and we're still learning every day about it. We're still learning so much about it. And so thank you for being vulnerable with us as well. It's a really nice share.
Yeah. Oh, well, thanks. Thanks so much, everybody. If there are no more questions, you're welcome, Jasmine. Thank you for being here today. Thank you.
Oh, Natalie. Hi. That's my clinic manager and amazing clinical nutritionist that works at my clinic too. She's
I was gonna say, for those of you who haven't attended, you will hopefully be watching this on replay. So an email will go out with this recording. And if you've got any questions, just reply to the email. If you attended today, you will be receiving the same email too. So any questions, feel free to reply. But thank you so much. Sending everybody lots of love. And Katherine, I am just like bracing myself for you, this cyclone. Um,
we'll see. We'll see. Hopefully it's not too bad, but who knows? Who knows?
all right,
Yeah.
lovely.
All right.
Thank
Thank you.
you.
Bye.
Bye,
Thank you so
everybody.
much.
See ya. Bye.